On occasion, we might be called upon to advise a group of non-RCPs about the clinical issues that carry important clinical ramifications for whole populations of patients to whom we administer care. For example, some nursing home administrators recently thought it would be a good idea to assign non-RCPs to the care of respiratory patients who were being mechanically ventilated. In response to that practice, a group of RCPs from the California Society for Respiratory Care, or CSRC, collaborated on a project that produced a position statement designed to persuade those folks that their worrisome staffing scenario posed a threat to patient safety. As an integral component of that effort, we composed an Interactive Annotated Bibliography, or IAB, a paradigm of our own design for practitioners of the Art of Persuasion. In this 40-minute lesson, we describe those attributes of the IAB that render it such a powerful tool in advocating for or against a specific procedure or practice pattern. The IAB is configured as a bibliography in order that it function as a source of numerous monographs and abstracts that have been published in the peer-reviewed literature. This greatly enhances its credibility. This trait is especially valuable if the target audience will be predisposed to challenge one's message. It's also annotated so that those who inspect it can decide whether or not a particular item would be of particular interest to them. This augments its granularity and demonstrates that we respect the presence of multiple competing demands on clinicians' time. The IAB is interactive in order to confer infinite granularity on the document. Those who peruse it can, if they wish, click on one of the numerous hyperlinks incorporated in the IAB and instantly be ushered to the full-text version of an article of interest. This functionality constitutes a huge time-saving feature, insofar as users can read and even download full-text hard copies of peer-reviewed papers at the stroke of a key. Finally, because the IAB is an electronic file, it is universally accessible from any computer or printer having internet connectivity. Perhaps you and some of your RCP colleagues have been asked to design a project that is intended to persuade a group of your counterparts to initiate a given practice, or alternatively, to discontinue a portion of your department's menu of services. On the other hand, maybe you want to introduce a new instrument or device into your department's inventory and want to create a comprehensive and authoritative document to present to your administrators, accounting team, and procurement professionals. The IAB might just be the ideal vehicle to secure their buy-in. Navigate through the material in this module, which is available from no other source, and refine your skills so that your efforts will result in the goal that you are seeking.